Welcome to our first episode. Today we're exploring such condition as sarcopenia. Many people are not aware of this condition, nevertheless it affects a pretty big part of our aging population. The term sarcopenia comes from the Greek word sarx, meaning flesh, and penia, meaning loss. This is a condition that's characterized by the gradual loss of our muscle mass and muscle function while we age. Fascinatingly, after the age of 30 years old, we start gradually losing like 5% of our muscle mass every decade. Sarcopenia can lead to a decreased strength, frailty, and ability to perform everyday actions like lifting weights, going up the stairs, or getting up from the chair. But remember, sarcopenia is not an inevitable part of aging. Awareness and early taking actions can make the difference. Stay tuned with us as we delve deeper into this condition in our next episodes. In episode 2, we delve into risk factors and causes of sarcopenia. There is no just one cause of sarcopenia, but it's more of interrelated risk factors that play a role in onset and going of one. These includes age-related changes that happens to our body, such as hormonal changes and decreased secretion of such hormones as testosterone or estrogen. Also, decreased amount of nerve cells that sends signals from our brain to our muscles, as well as our decreased ability to turn protein into energy or into muscles. Also, lifestyle factors such as non-adequate protein intake and physical inactivity can speed up the condition. Interestingly enough, about 1/3 of adult population do not consume proper amount of proteins for each day. Understanding these causes and risk factors can help us to take proactive actions in order to prevent or improve the condition of sarcopenia. In our next episode, we will delve more into signs and symptoms of sarcopenia. In our third episode, we identify signs and symptoms of sarcopenia. Actually, symptoms of sarcopenia can be really subtle, and you may not even realize that you have the condition. Generally, symptoms include weakness, fatigue, and inability to perform everyday tasks such as climbing the stairs or lifting heavy weights. Muscle loss often happens asymmetrically, which means that one limb can be prone to the condition more than the others. Here is a surprising fact. While weight loss can be an obvious sign of sarcopenia, it is possible even for someone who's gaining weight still be losing the muscle mass. It can be explained with building up of fat tissue accumulation while still losing the muscle mass. In the next episode, we will delve into how sarcopenia gets diagnosed and assessed. In episode 4, we explore the diagnosis and assessment of sarcopenia. Identifying sarcopenia can be challenging because it's often overlooked. Typically, a healthcare provider would use a list of methods. These methods would often include physical examination, studying of the medical history, and some specialized tests like dual energy X-ray absorption test in order to identify the muscle mass. Another interesting tool is a hand grip strength test. It's very simple yet very effective way to identify muscle weakness. Keep in mind that early detection and treatment can significantly bring quality into your life. Up next, we'll discuss prevention strategies. Welcome to episode 5, where we discuss the prevention strategies for sarcopenia. It's not just about slowing the process, but more about taking proactive steps in order to prevent onset or development of the condition. Regular exercises, particularly resistance and high-intensity interval trainings, can counteract muscle loss and help build up the muscle mass. A diet rich in protein helps to fuel our muscles, but we should also consider micronutrients like vitamin D and antioxidants. Surprising fact, research shows that follistatin, that can bind and inhibit myostatin, is a game changer in a therapeutic field of treatment of sarcopenia. Follistatin enhances muscle growth, offering promising preventive and therapeutic options. In the next episode, we will explore treatment options for sarcopenia. In our episode 6, we are looking into treatment options for sarcopenia. Alongside with a proper diet and regular exercises, certain therapeutic interventions can be considered. One of the options is hormonal replacement therapy known as HRT that aims to restore our levels of such hormones as testosterone and estrogen that decrease with aging. But remember, HRT isn't without risks and should be thoroughly discussed with your healthcare provider. Interestingly, studies have shown that follistatin, a protein that inhibits myostatin, can have beneficial effects for treatment of sarcopenia. By blocking myostatin, follistatin can promote muscle growth and in that way revolutionize the realm of therapies for sarcopenia. Next up, we'll examine the role of nutrition and exercises. In episode 7, we go deeper into the topic of nutrition and exercise in managing sarcopenia. Regular physical activity, especially such as resistance and endurance training, can help to combat the muscle loss or even to build up new muscle mass. The right nutrition can further amplify these benefits. Diets rich in protein, vitamin D, and antioxidants can support muscle health, and anti-inflammatory foods can combat chronic inflammation, a key driver for muscle degradation. In addition, research into compounds such as follistatin are quite promising and draw them as a promising therapeutic strategies for sarcopenia. Episode 8 explores the potential benefits of supplements in managing sarcopenia. While a balanced diet is the best source of nutrients, certain supplements may be needed for managing of sarcopenia, especially in older adults. These include protein supplements, vitamin D, and creatinine. Besides, controlling inflammation with non-steroid anti-inflammatory drugs or some natural compounds found in the turmeric or omega-3 fatty acids can be quite beneficial. But before taking any new supplement regimen, you should for sure consult your healthcare provider. In this 9th episode, we focus on the comorbidities that come together with sarcopenia. Sarcopenia doesn't occur in isolation. It is often associated with some other comorbidities, such as cardiovascular disease, osteoporosis or osteopenia, and obesity. For example, osteosarcopenic obesity, which is the concurrent presence of osteoporosis, obesity, and sarcopenia, can even increase the risk of falls and fractures in older adults. Interestingly, follistatin, that inhibits myostatin and promotes the growth of muscle mass, not only helps to fight sarcopenia, but also helps to fight osteoporosis by decreasing the activity of osteoclasts responsible for bone degradation. Our 10th episode covers the role of inflammation in such condition as sarcopenia. Chronic low-grade inflammation, also known by the term of inflammaging, plays one of the key roles in an onset and development of sarcopenia. Diets rich in anti-inflammatory foods such as fruits, vegetables, lean proteins, and healthy fats, alongside physical exercises, can help combat inflammation. Moreover, certain medications and supplements can help fight inflammation. Those can be non-steroid anti-inflammatory drugs with albeit some side effects from time to time, but also can be some herbal extracts that would decrease the levels of inflammation in your body. Stay tuned as we delve deeper into the topic of regenerative medicine protocols and strategies in order to have healthy aging and good quality life.